I would like to introduce you to Laura Magnuson from Cigna. Laura, are you on the phone and ready? Yes, you are.
I am. Yes. Yes. Thank you so much
today?
for having me. I am doing well. Thank you. Thank you.
I appreciate you being here.
Yeah. Yeah, thanks. I get excited when I get to talk about behavioral health, so I'm happy to do that. And as it was mentioned, so I work for Cigna as a behavioral clinical account manager, and I cover several different areas of the western region of the U.S. But I am an Arizona native and located here. And prior to coming to Cigna, I actually worked on the provider side. So most recently overseeing clinical operations at an inpatient psychiatric facility. So I get excited to talk about behavioral health, and then I get really excited when I get to talk to a group that is located in Arizona. So with that being said, I think if we want to move on and kind of talk about maybe some things that are being seen in employee groups or really just people in general related to COVID. And, you know, we saw that in New York, maybe things didn't feel so real when they were happening across the country. But now that, you know, we are appearing on national news related to this topic, these feelings might be increasing. So I just wanted to start with a few statistics and numbers here to lay the landscape of what did behavioral health look like even prior to COVID. So we know prior to COVID that 1 in 5 will struggle with a mental illness this year. I think it's interesting too when we look back at some historical information and we look at a time frame when the SARS epidemic was happening. We know that 29% of quarantine individuals that went through that time frame showed symptoms of PTSD or post-traumatic stress disorder. And 31% of quarantine individuals showed symptoms of depression. So we don't know right now in COVID what these final numbers are going to look like related to mental health, but we do know that prior to COVID, that 1 in 5 would struggle with mental illness this year. We also know that 8% have a substance use disorder in any given year. And depending on what study that you read, there's a variety out there, but alcohol sales at the current moment have really increased. I've seen 30%, I've seen 60%. So again, it kind of depends on the study that you look at. But there is one study that came from the Institute for Employment Studies that showed that 20% admitted increases in alcohol consumption during this COVID period. So again, I would anticipate that we're going to see this number rise in the following year when we get this information back. We also know that 19% are living with anxiety disorders pre-COVID. And there was a study that was done by Express Scripts that showed from mid-February to mid-March that anti-anxiety medications actually increased 34%. So again, I anticipate that with the impact of COVID, that these numbers are just going to continue to increase. And then there's the comorbid factor. So about 20% of Americans who have depression or an anxiety disorder also have a substance use disorder. And as individuals are working from home and there's less of a disconnect from when does work stop and when does personal life start, that has definitely been blurred related to COVID. You know, these substance use, anxiety, depression, you know, if you've had any conversations with employees, they're probably reporting having just some general anxiety as well.
You know, it's interesting when you bring up telecommuting, because I know I've seen a couple of reports, some on a national scale, some on a local scale, where it seems like the individuals that are telecommuting are seeming to enjoy it. So when we have increases in anxiety, is it just because of the additional pressures of my kids are home and I'm supposed to be homeschooling them. I've got responsibilities at work, and then possibly even just the loss of power of knowing that, if I was telecommuting a year ago, then I was okay because I could run to the gym and escape, or I could go meet my friends at a restaurant, and I had, the ability of doing things like that, where we kind of lost that control. Is it all this kind of compounding around that?
Yeah, absolutely. So there's so many different new stressors that are coming out during this time. So, maybe I'm working, but maybe my spouse was laid off. So maybe now there's some financial stress. With schools going into this virtual capacity, now not only am I a parent, but I'm a teacher, and I need to do what's necessary for my job as well, and still be able to take care of the house and get all of these duties done, and not having this feeling like we can escape our situation or get a breath of fresh air, if you will. And even, turning on the news, that can be really overwhelming also. So yes, all of these different factors, coming into play.
And you mentioned these numbers are pre-COVID?
These are pre-COVID numbers, yes. So
do you have any information where it's trending?
Well, I can tell you that, we always get our numbers in hindsight, so it'll be interesting to see what they have upcoming. But anecdotally, I can tell you on the Cigna side, initially when COVID started, we didn't have too many crisis calls come into us. And initially, the calls that we did receive were related to food and housing and financial needs. And if you think about it, that's the first thing that people are concerned about. So, their basic necessities of living. And so those were the calls that we were receiving. As this epidemic continues, now we're starting to see some of these mental health impacts take place. So I spoke with a colleague that works in the Maricopa crisis line, and he reported anecdotally that the calls that they're receiving now are really of a more acute nature, meaning that they're more serious. So individuals that are calling in are reporting feeling more suicidal than at the beginning of this pandemic. So that's really at the local level here in Arizona, what is being reported with our crisis hotline.
Wow. That's a substantial change.
Yes. Yes. And then everybody feels stress at some time or another. And like we were just discussing, there are different stressors present in our lives now. And these numbers are also pre-COVID. So, individuals would report different physical symptoms to their primary care doctor related to fatigue or nervousness, or, maybe irritability or anger. And really, when we talk about stress and we talk about COVID, this acute stress that we're feeling that's going on for a long period of time can really have a toll on our physical health as well. And part of that has to do with, when we get into these acute stress situations, our bodies are turning to this fight or flight. If you've heard of how do I survive during this time? And usually we'll turn to something that maybe we've experienced before, and we'll use that kind of coping mechanism. Well, I know myself, I have not lived through a pandemic. Most people haven't. And so their bodies are really responding kind of all over the place because they can't figure out what they should do to survive this time frame. So it's very possible that all of these physical symptoms that we see from stress could really be increasing because our body doesn't know how to handle it all. And of course, individuals are not reaching out for medical care like they were in person, right? So there may be an uptick in those virtual visits, but we know that individuals are not seeking out medical care as much, just for the mere fact of they don't know if it's safe to go out. They don't want to be exposed to COVID potentially.
Right.
So again, when we talk about what is that emotional experience that we might all be feeling, and then when we bring kind of work into the picture, of course, stress and anxiety. So that overwhelmed feeling of information. So it was mentioned at the beginning, right, of all the different headlines we're seeing on the news and AZ Central. That's all. We just don't know what should we be doing with some of this information. There's also this community feel, even pieces, right, where masks were recently mandated. So that's brought additional stress of is where I'm going to go safe? And am I going to be the only person wearing a mask? So all these different factors at play, and that's almost even turned into some kind of political piece as well. So that it really just heightens our stress levels. And if there's any kind of ambiguity, right, we don't know what the future holds. And we might even be experiencing some of this anticipatory grief. So we know things aren't going to be the same in the future. And so we're actually starting to grieve those things right now. And so, you know, we might also be returning to a workplace where not all of our colleagues are there or our coworkers, because maybe there were furloughs in the workplace. So there could be some grief related to that piece also. And then maybe there's this sense of responsibility for some of those community hardships. And then additionally, loneliness. So Cigna had conducted a loneliness study prior to COVID. So we did a study in 2018 and then also again in 2019. And what we found is that the feelings of loneliness and not having a meaningful connection with someone had actually increased over that 1 year time frame. So our initial report found that 2 in 5 individuals lacked that meaningful connection. And then in 2019, and it went up to 3 in 5 individuals were lacking that. And it doesn't mean that you're not surrounded by people. It just means that you could be really surrounded by people, but you don't feel like you can really relate to anyone around you or be able to share in a personal manner. So those feelings of loneliness were there prior to COVID. And of course, COVID is only exacerbating some of those feelings. So, you know, not being able to communicate with colleagues in the same way, right? So I know that with my colleagues, we talk a little bit about Zoom fatigue. So there might be some Zoom fatigue, even though we're really trying to connect in these meaningful ways. It still doesn't feel exactly the same as connecting in person. You know, and then there also might be some feelings of isolation due to some difficult decisions. So, you know, again, where do I go out in public? What is safe? Sometimes family members feel differently about activities they should be participating or not participating in. And then, of course, unable to share a mutual expression of concern given a job role. So maybe there's different folks in different boats experiencing different things. And I heard a quote, I thought it was great, that, you know, we're all in this storm together, but we're all in different boats experiencing different things. And that's okay. And that's okay to recognize as well. So as we talk about how do we handle these feelings of uncertainty, not knowing what the future holds, it's always good to have a couple reminders, right? And this is probably not any new information, but good to start bringing to the forefront of your mind. So getting adequate rest. And so making sure that you have some kind of sleep routine. I know for myself, when COVID first started, we were watching the news before we went to bed. I couldn't fall asleep after watching the news, so we needed to change some things in our schedule because it would just give me some anxiety and I couldn't turn my brain off. There are some great pieces out there as well. Calm, for example, is an app you can use that has different pieces. You can talk about different breathing activities to do as well before bed, but really get into some routine to try to maximize on that sleep schedule. The other is making sure that you're moving about and exercising. You know, as we went to moving or to working at home, some of that natural movement was taken out of our schedule. So trying to find ways to bring that back in. And of course, eating healthy can be beneficial. And of course, participating in whatever activity is that you find to be relaxing. And then emotionally, just making sure that you're reaching out to individuals that you feel like you can have a good conversation with and that can lift you up and not bring you down. So, really be picky about who it is that you're going to talk to when you feel like you need some assistance in working out some of your emotional feelings. Structuring your time is also really beneficial when we talk about uncertainty. We can control what we can control. We can't control anything else. So being able to place some of that structure and control into our day is going to make us feel better. And of course, it's important to know what your resources are. So if you need to reach out for professional help, it's okay. And there's now a variety of different virtual and digital options that are available, so you don't have to leave your home.
Yeah, I know we've been doing a campaign just to making sure that the EAPs that are available, or just the different telemedicine type benefits that we have through our clients, that there's actual push information that's going out to the plan participants in lieu of an old strategy, last year was just making sure everyone knew that we had a benefits website. There was a section on there for an employee assistance program, and these are the things and tools you can access by going there. But that we have shifted that. We're now engaging a little bit differently and just making sure that information is, continually being pinged out, just because I think it just might be a timing issue that, sometimes, when the time is right, it might reach the right individual at the right time. So that's just kind of been our focus.
Yeah, absolutely.
And it's interesting, hearing you talk about the different apps and kind of changing your day and your structure. I just know, personally, Kathy and I, we did that. We stopped reading anything that had to do with social media and or news after dinner, just because it would wind up our conversations, and then we were actually experiencing a little bit of sleep difficulty. And she found an app, and it's a meditation app, I believe, where when you log on, it will tell you how many other people are meditating at the same time throughout the world. And she thought that was really fascinating because she then had a secondary connection to something that she felt was calming herself, or I know it's been calming herself because I know her sleep patterns have improved dramatically just by doing stuff like that. But you're right, it's like these little recognitions and these little tweaks and changes that we can make as individuals just to kind of, cope with the additional stresses that are being bombarded on top of us.
Yeah, absolutely. Absolutely. Yeah, so just kind of continuing on that vein, of course, we need to know what's happening in the world to a certain extent, right, before we leave our homes and go outside. So we still need to remain educated about what's happening. But again, make sure just that you're utilizing those valid news outlets. And take notice of yourself. So, if you feel stressed out and then the next day you feel like your fear is becoming overwhelming, that it's kind of starting to turn into panic, check yourself and be aware of the resources that you have to reach out. But again, just like you said, limiting that exposure to the news. So get what you need, but don't sit and watch for hours or be on social media for hours. And sometimes that can be hard to do, but you just have to cut yourself off and set those boundaries.
Yeah,
and
again, that information is
we,
still going to be there tomorrow. It's
yeah.
not going to go away.
Yes, and it will probably just multiply, right?
Right, yep.
Yeah.
Ramp up in the cyclone.
Yeah, and sometimes you got to weed through it to figure out what it is that you need to take from that information, right? So even asking yourself before you start looking at the news, what is it that I'm looking for today? Like, what answers do I need? Because sometimes you can just get sucked in. And if these are the constant messages that you're hearing, it's going to just increase your anxiety and your fear about what's happening. So again, we need to be educated, we need to be well prepared, but in moderation as well.
And I was on a podcast, not to deviate too much, but I will anyway. I was listening to a podcast from a research team over at the BBC, and they were creating an algorithm which would allow individuals to put trigger words in, and or at least distressful like items, and they could blur the articles, and then somebody would then, if they clicked on an article, it would just pop up and say, hey, this article, you're free to read it. They're not trying to suppress news by any means. But they said this article contains, these stressful things to kind of prepare individuals prior to reading them. But during that process and kind of their test studies, what they learned is that if they were also pushing people back to the front page, then they were getting a bigger, swath of news with differing opinions versus many of the algorithms that are in our newspapers. I learned they will pop up that second article based upon the first article. So you kind of get in this, I don't want to say rabbit hole, because, there's certainly amount of good news out there, but it's like they're constantly feeding you the same thing over and over again because they know that you're interested in reading this article, so we're going to give you the same article, from a different author. And this isn't like the news apps versus like the specific publications. I just thought that was fascinating because I didn't really recognize that was happening from myself when I was reading the news. Until I actually saw that podcast, and then it kind of gives you the strength to step out and say, you know what, let's go back to the front page and let's see if I can find a different opinion, or at least something else to read about that is not just going to pull me down this path.
Yeah, that's fascinating.
So resources.
Yeah. So of course you want to make sure that you know your resources. EAP was mentioned prior, so absolutely that's a great resource. I will share with you that Cigna actually doubled the amount of EAP sessions up to 10 through September. So if you're a Cigna customer, then there's even an addition of those sessions that are available. But the resources that are listed here are for anyone. So you can go to cigna.com/COVID-19 or cigna.com/coronavirus. And you will see just a variety of different resources, from symptom checkers to different emotional well-being pieces like podcasts, a variety of different community support options as well. So if you need to find out, is there a food bank close? Because I have this financial stress. So lots of good resources that are located on those pages, and again, open to anyone, whether they're a Cigna customer or not. And I included this slide just because I think it's important to have information should you or someone start to feel like you don't know where to turn. The top left, of course, is the National Suicide Prevention Lifeline. And what happens when you call that number is it will route to whatever your local crisis area is as well. So that will get you through to the Maricopa Crisis Line also. And then sometimes texting just is easier and doesn't feel as pervasive maybe as talking on the phone. So the texting option is the 741-741. That's a national number that can be utilized as well. If you wanted to learn more about, children and adolescents, again, this is open to anyone at the Cigna/children families. And then we have more information on the next slide, but just to call out, we also offer a veteran support line, and this is open 24/7 and available for, again, any veteran that can call in, and has a variety of different resources that we can offer up to them. But one of those also is a weekly mindfulness call-in. So just another resource that you can have available if needed. And I just kind of wanted to close on this note because oftentimes, we have had so many different roles that we're juggling. I know for myself, I have a husband that started to work at home and 2 school-aged children, and things just got real crazy there for a while. And it's good to be aware and practice self-compassion, because like this quote says, you know, you can do hard things, but you can't do impossible things like homeschool your kids, work, cook healthy meals, keep a clean house, and maintain your sanity. So there's going to be lots of failures each day, and that's okay. Just try to keep a grateful heart and keep going. So again, practice that self-compassion, take a 5-minute break, breathe, walk around the block, practice whatever it is that you need to in order to focus on getting through and, you know, maintaining some of that compassion for yourself and others.
Oh, thank you, Laura. I appreciate your time, and I'm glad you were able to join us today.
Yeah, thank you for having me.
It's nice to be able to have somebody that really knows the details and can really kind of pinpoint what is happening in our community, you know, just from a different level. So I appreciate your time.
Thank you.